Hi, good afternoon. Councillor Steve Forster here, and I'm with Councillor Dr. Anne Crampton, who's one of the Hart District Councillors for Hartley-Witney. She's also on the Hampshire County Council Health and Wellbeing Board. She used to be a GP, retired a few years ago, but is very involved in looking after Hart community from a wellbeing standpoint. Today we're going to cover some of the topics that are a real concern to many residents around coronavirus. So Anne, over to you.
Oh, thank you, Steve. I thought I'd start with the basics that I think most people know by now, but I'll go over them again because I think these are very important. If you have symptoms, and the symptoms are a high temperature, over 37.8, and or a cough that's new, then you must suspect that you have the symptoms of coronavirus and you should self-isolate for 7 days. The new part of this is that the household, that's people you are living with, also have to isolate for 14 days. After which you will be better, and they, if they don't develop symptoms, can obviously leave the house and resume normal life. Well, as normal as possible. I think what we're saying to everybody at the moment is that you have to be aware that it is possible for anybody to catch this virus, and it makes sense to restrict some of your social activities. So don't attend big meetings, don't go to pubs, restaurants or theatres if you can possibly avoid it. If you can work from home, and if you don't have to travel, don't. Obviously, if you have to do any of these things, then you have to weigh up the risks against the benefits. But we're leaving it up, the country is leaving it up to you to decide what is best for you and your family. Then we come on to the more vulnerable people. These are people who are aged over 70 or have underlying health conditions. The sort of thing we're thinking underlying health conditions are the more common underlying health conditions, such as having had a stroke or heart disease or lung disease or kidney disease or neurological disease. They are at more risk from this virus. Those that have severe immunodeficiency, that's those who are severely immunosuppressed, will know about it anyway, and they will have been given advice, I'm sure, by their clinicians. If you are in that vulnerable group, it makes sense to really try and be very strict about your social contacts. So stay in the home as much as possible. You can go out for walks in the fresh air, that's a good thing to do, but try and keep away from people as much as possible. If you do see people, it's fine as long as you're about 3 or 4 paces away from them. So don't sit too close, don't stand too close to other people if you are in this vulnerable group. But I think it's quite a good thing for the rest of us to be aware that distance can make a difference. And then there's the usual about hand washing, and that really is important. The virus has a lipid coat, a fat coat, and soap will destroy the coating of the virus and therefore destroy the virus. So washing your hands is important. And if you go out and it's winter, I know the weather's mild, but if you go out and you can wear gloves, then that will also protect you.
And you talked about health conditions and so on. What about some of the ones that people might be worried about, like someone who's asthmatic or diabetic?
Again, there's degrees of asthmatics and diabetics. So well-controlled asthmatics, those who only use their inhalers when they get a cold or in the pollen season, as long as they use their inhalers, if they do have any wheezy symptoms, they should be fine. They are really at no greater risk. And we know that children and young people get a very, very mild illness, even if they're asthmatic. But you should be using your inhalers as normal. And it's the same with diabetics, that diabetics who are poorly controlled will be at far more risk than those who are very well controlled. So keep your diabetes well controlled, and that will help protect you. Keep your asthma well controlled, and that will also help you protect against this virus.
That's really reassuring. Thank you. I've had a lot of people contacting me to say that they were interested in volunteering, and Ranil has put up some pages for volunteers. But I think it's important to say that we now have Heart Voluntary Action working with Hampshire County Council and Heart District Council. And Heart Voluntary Action always supports and works with the local charities and volunteers, and they're going to take a very front role in working with the community and providing resources as that's needed. We're going to see a lot more coming out in terms of information from them, probably over the next few days, I think.
Yes.
We'll also see a lot of extra information coming from government and from Hampshire County Council, who are the lead agency from a local perspective. I'd stress what I said in the video that I produced yesterday about sources of information. There's Public Health England, there's the NHS and Hampshire County Council, plus of course Heart District Council. Those are reliable and will only give you accurate, timely information. Many other sources actually are repeating incorrect or inappropriate information. Please rely on those official sources for the information that you take on board, and do follow their guidance. It really is important to do that and help people in your family, yourselves, and those around you avoid getting sick. I hope that information is useful. Anne, myself, and some of our colleagues will also try and keep you up to date on a regular basis. We'll issue bulletins through email, as will the councils, etc. So please follow us. If you've got any questions, follow the recommendations on PHE and HS in terms of who to contact from a medical viewpoint. If it's to do with anything locally, by all means you can email me or your other councillors. All the councillors across Hart and across the different towns and parishes that we've got, and across Hampshire as a whole, are going to be working together on this. So it really needs us and the community to come together. Please support us, and we hope that you stay well.
Can I just add one thing? It really is a mild disease in the vast majority of people.
That's really encouraging. Thank you. Thanks.